is it that we find ourselves surrounded by such complexity, such elegance?
The genes of you and me, the genes of you and me, we're all made of DNA. We're all made of the same chemical DNA. We're all made of DNA.
Hello, you're listening to DNA Today, a genetics podcast and radio show. I'm your host, Kira Deneen. DNA Today informs you on what's happening in the genetic world. During my broadcast, I educate you, the public, on genetic and health topics through news stories and interviews. Guests include genetic counselors, researchers, doctors, patient advocates like today, and professors. My guest today is Lydia Seiders, the volunteer Maryland State Ambassador for NORD, which stands for National Organization for Rare Disorders. And through NORD's advocacy arm, the Rare Action Network is what she deals with. And her daughter was diagnosed with aplastic anemia, a form of bone marrow failure. And this motivated her to become ambassador for NORD. And in this role, she leads about 200 network members across the state to raise awareness for approximately 600,000 patients affected by a rare disorder. Lydia leads educational initiatives and develops state-based campaigns to increase patient awareness. She partners with advocates nationwide to act on policy impacting the rare disease community. Lydia also works with the Aplastic Anemia and MDS International Foundation and the National Bone Marrow Registry that you're probably familiar with, Be the Match. She assists patients and families globally to obtain reputable resources for bone marrow failure. And most recently, she began collaborating with the Rare Revolution magazine. This is a dedicated free disease publication, and she's going to be helping in sharing the direction of the Rare Revolution movement. So thank you so much for coming on the show, Lydia. You have quite a resume.
First, Kira, thank you so much for the opportunity to speak with you and your listeners today. In an effort of full disclosure, I just wanted to mention real quick, I am not endorsed, nor am I a medical professional. I am a well-read mother, a volunteer, and a highly trained advocate with over a decade of experience.
And I want to start out by you telling us a little bit about your daughter, Emma.
Emma is my reason for all of my volunteer work. She was first diagnosed at 9 and is currently 12. She loves reading and science and Harry Potter. She volunteers throughout our community, but the two most important positions that she serves in is the work she does at our local science museum and also the National Institutes of Health. She is a pediatric patient ambassador for aplastic anemia there. She is known internationally by the aplastic anemia community as #EmmaStrong and currently has the world's largest Facebook group following one patient with her condition. She takes this role very seriously. It is a closed group because she is a minor, but we work together to reach the audience that she wants to.
And very impressive for her to already be so much of an advocate and have this social media presence of social media just being so big in the rare disease community of bringing people together worldwide. It's just been so great for me on the outside, really, to see patient advocates coming together in that sense.
Absolutely. Before she even began her treatment, she said to me that she wanted to create a cause within her fight. And she really grabbed a hold of that and took it forward.
And where did your journey begin with all of this? When was Emma diagnosed with aplastic anemia?
I'm going to give you the short answer here because Emma is a complex case, even for the experts. Her journey actually started with liver failure in January 2016. She spontaneously resolved about as quickly as she presented, and then less than 40 days later, she was diagnosed with one of the rarest forms of aplastic anemia.
And how does this condition affect patients? For those that maybe don't know, what are some of the symptoms?
This is a very important question, Karen. I really appreciate that you asked that. Those impacted by aplastic anemia, whether themselves or a loved one, struggle to have this illness recognized as life-threatening, even by some medical professionals, because of the word anemia. So I'd like to briefly clear up a few things. Aplastic anemia essentially means empty blood and does not involve a patient's iron level being too low. It is not cancer, but the polar opposite. We know that with cancer, there is an abundance of cells. We can extract those cells and study them in a lab. With aplastic anemia, we have the lack of cells. You cannot take nothing and study it in a lab. Aplastic anemia is bone marrow failure. So when a patient experiences aplastic anemia, a patient stops producing enough red blood cells, white blood cells, and platelets. Someone without red blood cells can present with shortness of breath or extreme fatigue, but also sudden heart failure. Without enough white blood cells, the normal GI bacteria that exists naturally within our bodies can become life-threatening very quickly. Low platelets can result in spontaneous internal bleeding. And we're talking from bending over and picking something up. An injury doesn't even have to happen.
And so with all of this, do we know what causes aplastic anemia? Because as you're talking about there, it's really that empty blood that you're missing a lot of the components of healthy blood.
Yes, so that's another great question. Aplastic anemia has a few different types actually, but roughly 50% of the time, we don't know what causes it. We learned in the 70s and 80s when patients failed to engraft after a bone marrow transplant, this condition is actually an autoimmune disorder. A patient's T cells are triggered and attack their bone marrow, depleting all three blood components. However, this trigger isn't always located. Other forms are hereditary. It impacts approximately 1 in 1 million. This is what places Emma in the rare category of this already rare condition. Her bone marrow failure was actually caused by her liver failure. This complicates things with little to no data for patients, how they respond to treatment, or if they do, what the prognosis is for them.
And so you have an autoimmune disease where the T cells, which are part of the immune system response, attacking a patient's own bone marrow. And for those that don't know, this is where a lot of those cells start. And so they're kind of baby cells when they're in the bone marrow and then mature as they kind of go through the body and go to different places. So is that why there are really a lack of the blood cell components?
Correct, yes.
And what role does the NIH have in Emma's treatment? I'm sure that there's a lot of different doctors involved in other organizations, but the NIH is one of them.
Yes, that's correct. Emma is determined to provide that missing data for medical science advancements to take place with her specific type of this condition. And I fully support that choice. She recently wrapped up her 4th clinical trial at the NIH. So the standard line of treatment for this condition is a bone marrow transplant if someone has a full sibling that matches their HLA type. Emma does not have a full sibling. So it was recommended that she take the route of immune suppression therapy instead. After it was confirmed she had aplastic anemia, I started researching. I really needed to know what we were up against here. I quickly learned the name Dr. Neil Young and read about his research at the NIH. It was actually a YouTube video that linked Dr. Young and the Aplastic Anemia and MDS International Foundation. I started reading their educational material, and after speaking with one of their trained advocates, I had Dr. Young's contact information. Emma was admitted to the NIH within 24 hours of them receiving her records. Without a bone marrow match, Emma needed to have a portion of her immune system knocked completely out and then kept suppressed for 2 years according to that protocol. One of the clinical trials Emma participated in was a medication shown to stimulate those hematopoietic stem cells. Emma didn't initially respond to these treatments, and it was decided moving to Maryland was best so she could remain with doctors who were experienced with bone marrow failure. So she's actually followed by 8 of the 27 institutes because she is one of the rarer types and because of some of the side effects and complications that she's presented. The clinical center at NIH, or Building 10, known by some, it quickly became our home. I firmly believe that their experience and ability to pull several specialties into her care is the reason she is here with us today.
And so important to be able to find a clinical trial, especially in her case, where that really is the only option at this point, correct?
There are the standard line of treatment would be a bone marrow transplant, but 50% of patients who need a bone marrow transplant do not find one on the registry. So it bumps them into a category of either the route of immune suppression. Only 1/3 of patients who try immune suppression therapy do not respond to it. But the relapse rate after immune suppression runs between 40 and 60%. So you still end up needing a transplant at some point. Well, some patients do, not all of them.
It kind of delays just having to get one.
Absolutely. It also gives us our time to get a match on the registry because you really want that full match to pursue the transplant. NIH is running clinical trials with higher risk transplants, and we've seen phenomenal, just amazing numbers with those higher risks, but we really don't want to bump a patient straight to high risk transplant if we can do the immune suppression route or the full sibling match, or even it's called a MUD. It's a matched unrelated donor off the National Bone Marrow Registry.
Yeah, it's really important to be able to have that match. And there's different parts of that, I believe, of being matched. It's not necessarily just blood type. There's a little more to that.
It actually has nothing to do with blood type.
Nothing to do with blood type. I'm wrong there. Go ahead.
That's okay. A lot of people assume that, and even I did. If you don't deal with this specific situation, a lot of people are unaware. So HLA is actually a protein on our DNA, and that is actually what we match when we go through a bone marrow transplant. It's actually harder to find that match than it is a vital organ. So it's roughly 1 in 500 people who register on the bone marrow registry pop up to be a match. It's that hard.
Those are hard numbers. And people anybody can register for this, right? Be the Match is where they can go.
BeTheMatch.org, and it's between the ages of 18 and 44 are the ideal candidates because of the consistency of the bone marrow when you go through as the donor.
That makes sense. And what is the status of the current research for aplastic anemia? You mentioned a lot of clinical trials. Does it go beyond this?
So one of the most important thing to remember when it comes to aplastic anemia is finding an experienced doctor because it is rare. This is not to be confused with just any research facility or even a larger hospital. Even a really good doctor can go their entire career and never treat a patient with bone marrow failure. A couple of decades ago, aplastic anemia had a life expectancy of 6 months, but it's no longer a death sentence. It is manageable, but I cannot stress enough that an experienced professional be involved. Within the last decade, the team at the NIH has conducted multiple clinical trials. With their data, pharmaceutical companies have actually been able to achieve FDA approval for a medication used with what's called refractory aplastic anemia. So patients who attempted the immune suppression therapy responded, but then stopped responding. They added this medication and they saw enough success that the FDA approved it for that use. Now, currently, trials are being conducted and data collected with that same medication, but to add it to that standard line of treatment of immune suppression therapy to see if it would be beneficial. There's been 3 cohorts, and we've seen phenomenal numbers again. And this drug is under review process with the FDA. It's been granted breakthrough status, which essentially means the FDA has expedited the review process because we've seen such a great response rate.
Wow, that's really powerful. And as you said, I really want to point out that back in the day when someone received this diagnosis of bone marrow failure, it was 6 months was the projected survival. And now that's much longer. Do you know about what it is now?
That depends on if a patient is able to locate and get involved with an experienced professional with bone marrow failure. That is what's going to give them their best chance at survival. It is manageable when you know what you're doing. So Dr. Young's team is actually the team that conducted the first human clinical trials for the immune suppression therapy route of treating this condition. We have seen patients that go their lifetime and never relapse. We see patients that respond to treatment and then stop and have to go to transplant, and they're 30 years out. So it really just comes down to what treatment route you start and whether or not that medical professional has experience.
And for people to understand what their treatment options are, it's so important to be raising awareness for this and sharing resources. That's part of what you do as a state ambassador for NORD. What else is involved with that role?
So, Kira, NORD is our nation's leading patient advocacy organization dedicated to patients with rare diseases and organizations that serve them. With over 280 membership organizations, NORD is committed to identifying, treating, and curing rare disorders. Because of this, the Rare Action Network was launched in an effort to educate and unite advocates throughout our nation. As a RAN state ambassador, I serve as a volunteer in a leadership role to build a strong grassroots network across Maryland. I help to forge connections between NORD and my state's network, state agencies, and also officials. Together, we work to improve the lives of those impacted by a rare disorder.
And what is your approach with the educational initiatives and campaigns behind all of this?
As a rare disease mama, I know firsthand how alone one can feel within the rare disease community. Because of this, I take a more hands-on approach to all things. When and where appropriate, I meet with patients and families face-to-face. to truly learn what it is they are facing. As an ambassador, I help to raise awareness for all 7,000 rare diseases. It is my responsibility to echo back to NORD how our community needs help. Most recently, I created and launched a statewide tour for Maryland's Rare Disease Day awareness campaign. Network members and I covered 3,700 miles.
Whoa.
I had the opportunity. Yes, it was it started in January, went to March, and it was a long couple of months. But it was well worth it because I had the opportunity to personally speak with lawmakers from a local to a federal level about the rare disease community in Maryland. I've been invited to work with local health departments, school districts, and local businesses.
And it's so important to not only be raising awareness for the public in general, but to be talking to our policymakers and state representatives and congressmen to be able to say, this is what's going on, and I represent so many people. I think it's 30 million Americans that are affected by rare disorders. Did I get that number right?
That's correct, yes. And in the state of Maryland alone, there's over 600,000.
It's just an astronomical number because some people may think, oh, rare diseases, it's rare, it doesn't happen that often. But when you pull together all the people that have been diagnosed with rare diseases, and if you throw in the undiagnosed people, because that's a whole nother network and community, that number is huge. I mean, 30 million Americans, we're talking about a really big chunk. That's 1 in 10 or something close to that.
You're absolutely right. 1 in 10 Americans are impacted. So it's very likely that we all know someone. It's just possible because my daughter, Emma, she doesn't look sick. So unless we talk about it, people are clueless that she's a rare disease patient. So it's very likely you could live next to one for all we know.
And how can people help the rare disease community if they're not already active in it? Any ideas or tips for them?
Absolutely. So anyone, whether you're impacted by a rare disease or actually know someone, anybody can get involved. But the number one thing for advocacy is education. We need to learn about rare diseases. And that doesn't mean being able to pronounce them all. Some of them are like 48 letters long.
Sometimes the acronym works.
Yes, exactly. So understanding that it's not rare to be rare. And a fantastic way to get involved is to join the Rare Action Network. We're located in all 50 states. And NORD also has other opportunities to get involved through fundraising in really unique ways.
Yeah, they have lots of opportunities. And for those listening in Connecticut, the headquarters of NORD is actually right here in Connecticut, in Danbury. And there are so many people that are active in this community in Connecticut and, as you said, in all 50 states. What does NORD provide rare disease families? We've been talking a lot about the educational initiatives and the large-scale education, but how about when it comes to these rare disease patients and families?
So NORD serves the rare disease community as an umbrella of all things rare. For the last 35 years, NORD has been a pillar for driving supportive policy, advancing medical research, and providing patients and families services that need them the most. I highly encourage listeners to visit rarediseases.org to learn more.
And are there any particular, there are probably so many, but is there one or two particular patient stories that have really moved you, of people that you've met or heard from or been able to help yourself? It's kind of a loaded question.
It is, because I've come in contact with quite a few patients at the NIH alone. Most of those that I deal with are aplastic anemia related. Now, again, I advocate for all 7,000. But the ones that stick out the most are obviously the ones that I can identify with the most, and that's the aplastic anemia community. I've had patients contact me from around the world, and it's the aspect that NORD can provide that personal connection, because NORD genuinely cares about the patient and what they face. And it's encouraging to sit down with patients and families and explain to them that NORD exists, because they don't always know that, hey, there are people back here and we're working on policy so that when you go to your doctor, that medication is going to be paid for by your insurance company. Without policy in place to help protect the rare disease community, it doesn't happen. And a lot of people don't realize that.
The financial burden can be enormous for families with so many different medical appointments and medications, as you said, that it's so important for people like you and NORD in general to be advocating for them to prevent these things from occurring, because a lot of people have to take time off from work to be able to help their child or their loved one with a rare disease. And so it's really important to be supporting NORD and all of their advocacy efforts.
Absolutely, yes. And a great way to do that is by visiting rarediseases.org. Another thing that NORD provides patients and families on a state policy level is their third edition of their state report card. This report helps to analyze how states are performing with key issues that impact the rare disease community. These topics include things like Medicaid and CHIP eligibility, medical food coverage, prescription drug cross-sharing, and newborn screenings, along with several others. Listeners can view their state's report through rareaction.org.
And we'll include all of these links in the show notes, which are going to be at dnapodcast.com, but we'll plug that at the end because I have one more question for you that I like to end with patient advocates of what advice you have for parents of children with rare diseases and any resources to recommend of kind of taking yourself back to when Emma was diagnosed and you were starting the journey.
Oddly enough, NORD was actually one of the first links that I clicked on. Outside of the Aplastic Anemia and MDS International Foundation, NORD, I believe, was the second research finding that I found and read on. So I would highly encourage anyone diagnosed with any rare condition, jump on NORD's website, and there's a location where you can plug in what your rare disease is, and you can learn about what the condition is, how the symptoms present, as well as find patient organizations. That's why NORD is a membership organization. You can find patient organizations that specifically tailor to your condition's needs, whether it's locating a specialist for it, locate special funding that may be available to help pay for treatments. And then, of course, I have to also mention the Genetic and Rare Disease Information Center. It's a program out of the National Center for Advancing Translational Science out of the NIH. The NIH funding is through the Congress. So one of the reasons I got involved with advocacy work was because my child is impacted and is treated at NIH. And without policy, NIH and their funding goes away. So it's important to have that policy in place. So any parents that have children who have been diagnosed, jump on rarediseases.org, plug in your child's information with what they were diagnosed with, learn the condition, be able to have an educated conversation with medical providers. You as a parent are your child's strongest and loudest advocate. When you learn about that condition, you can sit down with medical professionals and know whether or not they are the right professional to treat your child. I had to make that decision. It's not easy because you want to trust the doctor that you've been with, that your child knows, but sometimes with a rare disease, you have to travel to a different location to get your child that best option to survive this condition.
And it's so, so important that you are your child's best advocate. You're the fiercest one. You're going to be the most passionate about it. And arming yourself with all of this knowledge is only going to help bring better care to your child because you'll be able to figure out, okay, this doctor knows what they're talking about, this one, not as much, and being able to figure that all out. Thank you so much, Lydia, for coming on the show and sharing about your daughter's aplastic anemia and all of this really fierce advocacy effort that you've been doing. And I'm looking forward to seeing everything else that you have in the future for doing this, and just really want to thank you on behalf of the rare disease community.
Thank you so much again for having me on.
Definitely. And you guys can find Lydia on social media. Her last name is spelled Seiders, and she's very Googleable. So if you type that into the search engine, things will pop up. You can also start on Twitter at LSIDERS3. That's her Twitter handle. And again, to learn more about rare diseases, go to NORD's rarediseases.org, and you can sign up for the RAN, the Rare Disease Action Network, at rareaction.org. And more information about the show, and again, we've mentioned a lot of links on this show because we're really trying to educate you guys, so head over to dnapodcast.com. The blog post for this episode will have all those links and more. We have a lot of information for you. I'm on Twitter at DNA Podcast, on Instagram at DNA Radio, and any questions for us can be sent to info@dnapodcast.com. Thanks for listening, guys, and join me next week to learn and discover new advances in the world of genetics.
The genes of you and me, the genes of you and me, are all made of DNA. We're all made of the same chemical DNA.